is a training video on how to prone the intensive care patient. So we will not be wearing gloves and aprons as we normally would do in the clinical area. We've done our pre-proning checklist as per our guidelines. We need ideally 7 staff, 1 airway trained at the top of the patient's head and 3 each side. You may need more if there are any chest drains or ECMO cannulae. We have our staff in height order as per our manual handling guidelines. First of all, we need to place the sliding sheets underneath the patient. The sliding sheets have been folded, 2 sliding sheets have been folded together. We will place them underneath the patient's bottom sheet, and the 2 staff will hold to the tops of the sheet, the sliding sheets, and together roll the sliding sheets underneath the patient's. Roll. And again, and again. Holding onto the top at all times, and again together, and again, until the sliding sheets are completely underneath the patient. Okay, we need to consider all pre-proning checks as per our guidelines. Pressure area care is important if there are any lines in the groins that could be causing damage in the prone position. We need to take off all unessential monitoring, aiming just to leave the saturations probe on to monitor oxygenation throughout the procedure. Any infusion lines that are not necessary during the procedure could be removed. We then need to take off the patient's hospital gown and place some pillows over the chest and pelvic area to allow minimal pressure on the abdomen when the patient is in the prone position. If we can place both arms against the hips and thighs with palms facing into the patient. If we're happy with our pillow position, we can place a top sheet over the patient. With enough to go under the head, but just pulled back for the manoeuvre, please. And if we can make sure both sheets are taut together, tightly together at the ends. And we will now roll both sheets in together towards the patient. Nice and tight, so the pillows stay centred and in the position we've put them in. Okay team, what we will do, we will move away from the ventilator on ready, steady, move. So to my right, we will then go up into the lateral position with you and my right side hands up, and then you will take over from the hands at the top and my right side will pull the top sliding sheet. Is everyone happy with what we're going to do? Yes. Okay, I am happy with that. I have my airway and ventilator tubing. Okay, so on ready, steady, move to my right. Ready, steady, move. Ready, steady, up. Take over on the right side, please. And then the left hand. Okay, and ready, steady, move. If we can remove the top sheet, please, and place all monitoring back on. We need to check that we are happy with the pillow position. Some small adjustments may be necessary if they have moved during the procedure. Manoeuvre. All infusion lines are put back on. If we can place a hospital gown back on the patient. And to avoid pressure and joint damage, we may need to place a pillow under the shins or some ankle gels under the ankles, please. If we can put a head jelly underneath the patient's head. A half moon gel is placed under the patient's head, making sure there is no pressure to the eyes or the ear and the ET tube is free. We will check the abdomen is free from any pressure. We now need to place the arms up into the swimmer's position, please. So if we can have this arm up, careful with the shoulder joint and no more than 80 degrees abduction, and this hand will stay here if there is no contraindications to this position, and this should ideally be changed every 2 to 4 hours. We will remove the sliding sheet before we position the bed. We fold the sliding sheet in and bring it out at the top. We can now leave the patient in the prone position for up to 16 hours. We will put the bed into the reverse Trendelenburg position to minimise facial edema. We are now going to deprone this patient. We already have the sliding sheets in as per the earlier demonstration. We can take off the patient's gown and detach all unnecessary monitoring, again leaving the saturations probe. So we have some oxygen monitoring throughout the procedure. All unnecessary infusions have again been disconnected. We can take out the gels from the patient's ankles. And we can bring both arms against the patient's hips, thighs, with the palms facing in. And we can now put a top sheet over the patient. Leaving enough to go under the head after the manoeuvre. And we will now remove the jelly under the patient's head. And we will roll the sheets together tightly towards the patient on both sides. We are going to move towards the ventilator to my left, up to the patient facing the ventilator, and then over onto her back onto the right side. Is everyone happy with what we are going to do? We will move on. Ready, steady, move. Okay, ready, steady, move. And up on this side, ready, steady, move. And if the team on my right take with the right hand and the left, this side hold the top of the sheet, ready, steady, move. We uncover the patient, please. Re-establish all monitoring. Place a gown over the patient. We can now remove the bottom sliding sheet, the one remaining. If you push it in from the bottom, we will slide it up to the top, removing it from the patient.